Dr. Talley, you're the founder of the American Academy of Craniofacial Pain. How do you go about creating awareness about TMJ even among other professionals?
There's two levels. One is the professional level, professional to professional, and that's the medical community and the dental community sharing and supplying information to one another. And again, based on fact and anatomy and science, not on my opinion of what does this or what does that. Do I like this or do I like that? I take those out of my equation. And that is where we educate doctors, physicians, dentists, all types of physicians and dentists in that sense, even chiropractic physicians, all the specialties of medicine, especially ENT and orthopedics, and then other professions, physical therapy, body mechanics specialists, people who deal in rehab, things of that nature. But educating the professionals, and that's what organizations like the American Academy of Craniofacial Pain does, and I teach in a number of those with other people. And by the way, I'm one of 15 people that founded that academy. I'm not the sole founder of that academy, but the 15 of us were the people who put this together back 20 plus years ago, almost 25 years ago now. And our purpose was to educate the professions. But we also have another subcategory where we educate the public, and that's using support group elements, educators that are outside the field of dentistry that can provide information, data, resources, knowledge, direction, referrals, for instance, to appropriate practitioners who can deal with these problems for them. And that's where that comes in, to see the public's involvement in this. And it's an ever-challenging issue because there's so many problems the public has in health that this is just one, but it is such a demanding one for so many people that there's so much inadequate information that we keep this constant sharing. And it's getting better and better with new media opportunities and things of that nature to share this information. And then we have to assess it. And that's where it comes into how do you make a diagnosis, how do you evaluate people. And it takes time, it takes interview, knowledge, history. The history is the single most important thing. From the history, I can almost build a diagnosis without even touching someone. But the examination, the physical structural evaluation of the head, neck, jaw, face, mouth is critically important. And then understanding what you're looking at. Not everyone's trained the same. Different doctors have different backgrounds. And medicine doesn't know much about dentistry. Dentistry doesn't typically know much about medicine outside of the mouth area. So those of us who do this are kind of a hybrid. I'm a dentist, but I don't practice general dentistry. I deal with pain and dysfunction, and that leads also to airway problems, which is a spinoff of this. But all this system gets in trouble, and it can have pain associated with it, which is the biggest motivator to most patients to come in and see us.